Right, well, the health department says although getting the vaccine against COVID-19 is still a personal option, those who choose not to take the jab could be left out of important events. These include festivals, major sporting events and even international travel. On Sunday, President Cyril Ramaphosa announced that government was looking at introducing a vaccine passport system which could be used as evidence of vaccination. Currently, cards and SMSs are issued as confirmation after getting the jab. The announcement of vaccine passport system has raised concerns about the choice people are given in taking the vaccine. For more on this, let's bring in health activist Dr. Kgosi Letlape. Dr. Letlape, it's always a pleasure to see you. Thank you for joining us here on SABC News this afternoon. Please unmute yourself, Doctor. There we go.
I am unmuted.
All right, I think the problem was on our side. We can hear you now. Good afternoon, sir.
Good afternoon to you, Flo, and good afternoon to the viewers.
Yeah. So my question was about what your stand really is on this debate about vaccine passports. I mean, a lot of people raising issues and some quite important ones, some comparing it to, the Donbass where, your movements are restricted. I mean, what do you think about this issue of vaccine passports? We've seen there have been protests in various parts of Europe regarding this issue, and it would be interesting to know how, health experts view this issue.
I think it's going to be important how it gets articulated. If we go back to basics, when we started in March last year with the restrictions, it has been mandatory that if you do not wear a mask, you can't be in public. Entry is restricted to people that are not wearing masks. And no one has spoken about your right not to wear a mask. There's the issue of the collective. There's the issue of making public health and public spaces safe for all of us. So if we have signed on to, if you're not wearing a mask, you can't enter a mall, you can't enter certain spaces. What makes it difficult to say, if you have been vaccinated, there might be certain restrictions that might be withdrawn for those that are vaccinated. I think how you articulate it becomes important. When you say, if you're not vaccinated, you're going to be banned, we're going to take things away from you, it goes back to apartheid language. But if you say, if you're vaccinated, it'll enable you to be able to attend restaurants, attend festivals. These are recreational activities. These are non-essential activities. Nobody is going to say, if you're not vaccinated, you can't get into a mall to go and buy essential foods. Nobody is going to say, if you're not vaccinated, you can't go to school. So I think sometimes we take things out of proportion and we create a mountain out of a molehill. We got to practice Ubuntu and understand that we got to work together if we're going to beat COVID-19.
But Doctor,
work against one another.
And let's go to the point of this issue of vaccine passports. The point is to indeed encourage people to get vaccinated. And some people are choosing to take the consequences that, if you're not vaccinated, you can't go into festivals. I saw one of the musicians saying that, you won't be able to attend any of my shows if you're not vaccinated or you don't bring a vaccine passport. And quite frankly, a lot of the responses that this particular individual got was, we don't care. We don't care if we're going to be blocked out of coming to your concert, then you're losing out. So it becomes quite a ripple effect where, you're almost cutting the nose to spite the face. You will lose out on business based on the fact that you're saying, if people are not vaccinated, they cannot come into my business, or they cannot walk into, my festival, or they can't. I mean, it just creates a very strange environment. And I wonder if there are better ways of, putting this thing across of people being vaccinated without these. To me, to be very honest, it sounds a lot like a threat.
Well, I'd like to stick to being a healthcare professional. And choice is important as a healthcare professional. And whatever you choose, we will not discriminate against you. You will not be denied treatment. You will not be denied access to hospitals because you chose not to vaccinate. And the way I would articulate it and the way I would approach it would be to inform people of the consequences of not vaccinating. because it is not just about you. If you don't vaccinate and you stay in your house, that's fine. But once you get into the public space, your chances of being infected are much higher. Your chances of severe disease are higher. Remember, when we started, we were saying to people, please wear your masks, please follow the restrictions so that we can keep the hospitals not overloaded. The message is the same. Please vaccinate so that we cannot have overloaded ICUs. Please vaccinate so that we can curb the spread of infection. Please vaccinate so that for your own safety, you do not have severe disease, you reduce the chance of dying if you get infected. Let's look on the positive side of what we do for each other and what we do together to combat the spread of the virus. To put it into issues of this will allow you to go into a liquor store to buy alcohol or to go and listen to music is to trivialize the fact that we are in the middle of a pandemic that is destroying livelihoods, that is destroying families, that is a burden on a healthcare system, a burden on the economy. The sooner we all work together against this virus, the better for all of us, so that we can stop the job losses and we can have our economy open quickly. Yeah. We work on the power of persuasion rather than the issue of the stick. We don't work with the stick as medical professionals because our ethics don't allow us to be having a stick over our patients' heads.
Yeah, and that's interesting indeed. And as a matter of interest, you know, how far are we as a country in terms of getting to where we're supposed to be when it comes to vaccinations? You know, I am seeing some reports which are saying some of the vaccination sites are empty. I don't know if they're empty because people have been vaccinating, or if they are empty because those who would have vaccinated have already done so. And it's really a case of those who haven't vaccinated at this point.
I think we need to be more creative around that aspect to say, how do we take the vaccines to the people? We've waited at the mountain and the people are not coming to the mountain. Now the mountain must go to the people. I think we have to change the ethos of our healthcare system, where it's not about people coming to get healthcare. It's about us taking health services to the people. So there are other ways in which we can look at alternatives. Take this into the general practitioners' rooms, the nurse practitioners' rooms, take it into where the people are, and let's carry on promoting it. If you look at it, the most vulnerable group are the over 60s with comorbidities. Most of them will be having care either at the clinic or the local GP if they can afford it. Let's take it to those places. Let's see this as something that is not acceptable. That when we are at the levels where we are, where the highest province in the vulnerable group is not more than 30% of adults vaccinated in Limpopo or in the Eastern Cape, which are the leading provinces, we are way behind. And we should all work together. Let's take it to the family. Let people understand this. When any of your family members is not vaccinated, their chances of getting infected outside are much higher. And their chances of bringing it into the home and infecting others are much higher. And we've seen the severity of disease, particularly in unvaccinated people, with this Delta variant. Yeah. So let us work together so that we make South Africa a safer place. We ensure that we curb the spread of this virus. We need to ensure that as many people as possible are vaccinated as soon as possible. The problem we should be having in South Africa should be we exhaust the supplies that the state has right now, and we should be asking them to get more. Not to have the little vaccines that we have not being in people's arms.
All right, Dr. Letlape, thank you as always for availing yourself to SABC News. We certainly do appreciate it. Thank you, sir.
Thank you very much. Thank you for the invite. And people, let's get out and vaccinate for all our collective selves.